Guys, welcome back to new video, and in this video we are going to discuss about the prenatal testing. What are the natal testing are done to detect any of the congenital anomalies, genetic disorders at the early stage. To detect that genetic disorder, this test is conducted. In that there are two tests, that is the screening test and the second is the diagnostic test. Again, in the screening test is a non-invasive procedure where without opening of the any body parts or this test will be done. Again, in that it's under the the screening test will be divided into the two trimester. First trimester and the second trimester. In the first trimester means at the 3 months. First trimester 0 to 3 months will be the first trimester. At that knuckle transparency and the double marker tests are conducted. Knuckle transparency, also known as the NT scan. This is a double marker test. Then the second trimester. In the second trimester, there are triple marker test, quadruple marker test, and the anomaly scan. These are the tests which are going to come into the second trimester. Along with that, there are CT scan, MRI, USG are going to conduct. It's sort of the screening test at the non-invasive procedure. Where if you look at the invasive procedure, where the diagnostic test, where diagnosis, with help of diagnosis, we are going to find out that anomalies. That is the cardiosynthesis, means the blood sample will be collected from the cords, that is the cords, then that sent for the laboratory investigation. In that there will be genetic abnormalities will be identified, that is the chordosynthesis. Then the amniocentesis, means amniotic fluids will be collected from the fetus, from the mother, and that it around 10 to 15 ml of amniotic fluid will be collected and sent for laboratory investigation. If through that you can easily identify the genetic abnormalities, that is the amniocentesis. Chorionic villi sampling, through the it's also same, that is a blood sample will be collected and the through the villi, and it will be sent for laboratory investigation to find out the any of the abnormalities, that is a chorionic villi sampling. And the fetal blood supply, this is a fetal blood supply and the maternal blood supply. And then the fetoscopy, means that with help of fetoscope there will be examination be done. And it's all about the screening test and the diagnostic test. These are two tests which comes under the prenatal testing. There is a invasive and non-invasive. It is non-invasive and it is invasive. I hope so that you understood. And if you want to know about the any topic, let me in the comment section, and the next video we are going to come up with that. And until that, if you are not yet subscribed, then subscribe and see you in the next video. That's it for today.